Sir, my problem is that I am suffering from a severe giddiness for the last 5 days. In fact, sir, for the first 3 days I could not wake up and come out of the bed. Sir, there was a feeling of vomiting, but I did not vomit yesterday, but the nausea is still on and off till now. Sir, my local physician gave me Vertigo, Stemetil and Stugeron, each tablet 3 times a day. In fact, sir, on the first day I was vomiting so much that I could not take the medicine, and I was given 2 injections of Stemetil that put me to sleep. Today, maybe due to that, I am able to come up to you, sir, and the medicines were of a great help.
Please elaborate on the giddiness part. Was it one continuous, unabated phase of giddiness that slowly subsided over 5 days? Or were you getting recurrent small discrete attacks of giddiness? If so, then how long was each specific attack of giddiness persisting? For a few seconds, for a few minutes, or was each attack continuing for say an hour or so?
Sir, I think the giddiness is continuous, but as I told sir, it was aggravating when I was going to do some work like sitting up to take the medicine or going to the toilet. Sir, I have seen that after taking the medicine, when I was laying down on the bed, there was a feeling of nausea, and which was followed by vomiting 2 to 3 minutes after.
Do you mean to say that you were getting the giddiness only on lying down or getting up from bed and while turning towards one side? That means, were you getting the attacks of giddiness only on change of head posture? Yes or no?
Sir, the giddiness is continuous, and sir, you are very correct. I have seen for the last 2 days when I was going to do some work, like I'm taking the medicine or sit up or down in the bed, it was aggravating, sir. And I have seen also that when I was turning my head to one side, the giddiness was there, and it is actually still now. It is going on.
Do you have any ear-related symptoms like any deafness, any blockage of the ears, any buzzing sound in the ears, anything that you can relate with this attacks of giddiness?
No sir, nothing like that. Apart from the giddiness, nausea and vomiting, there was severe sweating and a bit palpitation, some amount of palpitation, and apart from that I could not remember anything right now.
I am asking you once again, please recollect and tell me perfectly. Were you getting the attacks of giddiness only on change of posture, or was it one continuous phase of giddiness? I have asked this once, I am asking you once again. Were these attacks being precipitated only and wholly on change of posture and nothing else? Were these attacks of giddiness unprovoked, or were they occurring only when you changed posture, like getting up, lying down, turning towards one side, while standing, supposing you are moving the head up, moving the head down? That means any change of head posture. Were the attacks of giddiness occurring only on that, or otherwise also? That is very important. You will have to please recollect and tell me properly. Another thing is that you said that these attacks of giddiness were for a few seconds only, as you recollect. Was it like this, that initially when it started, the intensity and the duration of the giddiness was a little more? That means the attacks of giddiness were, say, for about half a minute or so, or a minute at the most, and then now it has reduced both in intensity as well as in duration, and the attacks now are just for 4-5 seconds, 10 seconds or so, because in about 5 days time some natural recovery takes place in most of these cases, and the intensity and the duration usually slowly subsides. See, why I am asking you the same things over and over again is that because in a patient of vertigo, the exact and perfect history is very, very important. We will of course be doing a lot of investigations, but the main diagnosis will come from a vivid history, and how well you describe the attacks. Upon that will depend how perfectly I can diagnose what you are having. Okay?
Sir, you are correct. I am a bit confused right now. Sir, when I was lying flat on the bed, I did not have any giddiness, and especially, sir, when I was on my right side in a crouch position. Even on the first day, I did not get the feeling of giddiness on that day, as far as I remember, sir.